Hi, my name is Kristen Bevalet, and I'm a nurse practitioner student at Auburn University. Today I will be discussing restless leg syndrome, also known as RLS or Willis-Ekbom disease. RLS is a sensory motor disorder that causes an irresistible urge to move your legs. This sometimes can include the trunk and arms. Symptoms include crawling, tingling, burning, or itching, and are most commonly felt during periods of rest or inactivity. Symptoms of RLS are often relieved by movement. Risk factors that put patients at higher risk of RLS are those that have iron deficiency, Parkinson's disease, kidney failure, diabetes, peripheral neuropathy, pregnancy, and those taking certain medications, including most antidepressants, antiemetics, antipsychotics, and some antihistamines. Early onset of RLS includes a diagnosis at an age less than 45 years old, and then greater than 45 years old is considered late onset. Early onset of RLS is often related to genetic predisposition and familial issues, and late onset is often more intense with the symptoms. Three questions that you may ask your patient with restless leg syndrome are: number one, a diagnosis of RLS requires that patients exhibit all of the following, which are an urge to move the legs that begins or worsens during periods of rest. It must be partially or totally relieved by movement and occur predominantly in the evening or nighttime. So the first question I would ask would be, when you go to bed in the evening, do you have a creeping, crawling, or uncomfortable feeling in your legs that is relieved by movement? If the patient answers yes to this question, RLS is most likely a diagnosis. The second question would be, do you have any chronic illness? Restless leg syndrome can be caused by many chronic illnesses such as iron deficiency, kidney failure, diabetes, and neuropathy. However, some issues such as chronic leg cramps, claudication, dermatitis, growing pains, and ADHD could result in chronic leg movements and or leg pain that do not coincide with restless leg syndrome. The third question I would ask are, what medications are you taking? Many common medications can cause restless leg syndrome. All antidepressants except bupropion increase patients' risk of symptoms. Antiemetics, Parkinsonian drugs, antihistamines such as pseudoephedrine, and anti-epileptic drugs also put patients at risk of symptoms of RLS. The physical exam of a patient should consist of mostly the patient history of symptoms and visual observation of any type of foot tapping, knee rubbing, or continuous movement of the legs. The physical exam generally evaluates for potential other causes of symptoms such as neuropathy or iron deficiency. If neuropathy is suspected, a nerve conduction test can be performed to assess nerve function. If iron deficiency is suspected, which is a common cause of restless leg syndrome, serum iron, ferritin, transferrin saturation, and total iron binding capacity should be drawn and evaluated to rule out this cause. Dopamine agonists are the first-line medication recommendation for treatment of RLS, and this includes the medications Requip and Mirapex. Requip is usually dosed between 0.25 to 4 milligrams 1 hour before bedtime and should be titrated up by 0.25 milligrams at a time. Mirapex is 0.125 to 0.5 milligrams 1 hour before bedtime to relieve symptoms. Patients can also use the anticonvulsant Horizont, which is a form of gabapentin. It is dosed 300 to 1200 milligrams every day around 5 p.m., and they should take it with food. 3 teaching opportunities for patients with restless leg syndrome include: 1, prevention is key. Regular low-impact physical activity such as stretches and evening walks can reduce symptoms of restless leg syndrome. Number 2, avoid use of caffeine, alcohol, and nicotine as these can worsen symptoms of restless leg syndrome. Sleep deprivation is the worst side effect of RLS, so delay wake time if needed to achieve adequate rest. And 3, restless leg syndrome is a lifelong condition without a cure. Symptoms may get worse and require increased dosages, so let your physician know if symptoms worsen or are not currently controlled by your treatment. I hope this video has been very informative on restless leg syndrome, and thank you for watching.